health is defined as a state of complete physical, mental and social well-being. Health is a state of complete physical, mental and social well-being. Any departure from normal health is the pathological condition. Clear? But the disease has not been clearly defined, as disease manifests in various forms. It may be clinical presentation, that means when the signs and symptoms appear, we can say that yes, this person is suffering from the disease. But when a person is in a subclinical state, that means apparently he is healthy, but he is suffering from that particular disease. If we say that diphtheria patient may have signs and symptoms of diphtheria, but patient may not have any signs of diphtheria. He may be in a carrier state or he may be in a subclinical state. That is why disease has not been clearly defined, but health is defined by WHO. That means health is a state of complete physical, mental and social well-being. So, any departure from normal health is the pathological condition. Now, how the disease starts? You have probably heard the term epidemiological triad. Epidemiological triad, that means one is agent, another is host and another is environment. What is agent? Virus, bacteria, protozoa, or it may be some inanimate objects, non-living things, maybe the poisons, maybe some chemical agents, maybe radiation, maybe excessive heat. So, agents. What is host? Host means who are the main sufferer. Usually we consider the human being or the animals. So, host who harbors the disease agent. And what is environment? Environment means all the surroundings which is external to the human, or it may be the internal environment. So, environment is all the external surroundings to the human being. So, usually there is an equilibrium among agent, host and environment. If the equilibrium is disturbed, then and then the disease process starts. How the equilibrium is disturbed? If there is natural disaster, it may be cyclone, or it may be volcano, or it may be earthquake. So, if the equilibrium is disturbed, or if the environment is suitable for breeding of the various vectors or multiplication of the organisms which are infective to the human beings. So, if the equilibrium is disturbed among agent, host and environment, then the agent will take upper hand and the agent will multiply, and ultimately the person will suffer and he will manifest various signs and symptoms, and ultimately the physician or the clinician will say that yes, this person is suffering from chickenpox, or this person is suffering from measles, or this person is suffering from diphtheria. But what the clinician sees, what the physician sees, he is seeing only the tip of the iceberg. Tip of the iceberg. Why I am saying tip of the iceberg? Particularly for non-communicable diseases. What do you mean by non-communicable diseases? Non-communicable diseases means those diseases which are not transmitted from one person to another. As for example, coronary heart disease, hypertension, diabetes, cancer, road traffic accident. So, these are the non-communicable diseases, and physician or the clinician sees only the tip of the iceberg. Suppose in this hospital, one physician diagnosed out of 100, 10 persons are suffering from diabetes mellitus. What is the diabetes mellitus? What is the cutoff level of blood sugar? For fasting it is 126 milligram %, and for postprandial, that means after taking meal 2 hours after his meal, if you draw the blood and if you do the blood test, that is the postprandial blood sugar. It is cutoff level is 200 milligram %, 200 and above, and HbA1c, that is glycated hemoglobin, it is more or less 6.5 and above. So, these are the cutoff level. So, on the basis of the result, either fasting or PP or HbA1c, a person, 10 persons were diagnosed as suffering from diabetes mellitus, type 2 diabetes mellitus. So, it is the tip of the iceberg, but if the public health specialist, that means the community medicine specialist, goes to the community and he collects data based on house to house search and random checking of blood sugar, those who are above 30, actual figure will be surfaced that not the 10% out of 100 people who attended in the hospital are suffering from diabetes, it is more than 10%, it is about 15 or 20%. So, it is the role of the epidemiologist or the public health specialist to highlight the true picture of diabetes or true picture of hypertension or true picture of cancer. Clear? So, here agent host environment, this triangle is basically meant for communicable diseases, where there is clear cut distinction among patients who are suffering from the disease and those who are not suffering from the disease. But in case of diabetes, in case of hypertension, in case of cancer, the various risk factors are involved for the causation of the disease. That is why, or the mental health illness, you cannot say at which time this person starts suffering from diabetes or this person starts suffering from mental illness. So, there are multiple factors involved for causation of non-communicable diseases. That is why it is really difficult to distinguish among cases and among healthy persons. Clear? So, this triangle is basically implied for communicable diseases. So, it is the interaction of agent, host and environment. Not only the presence of agent, host and environment will give rise to disease, but it is the interaction among these three. Clear? And what is the time? Time means what is the course of illness, what is the time of incubation period for the manifestation of the disease. Do you know what is incubation
second
period?
floor mane 3 tala.
Incubation period means when the disease agent enters into the body and when the signs and symptoms develops. So, it is the duration of illness, it is the duration of illness between entry of the offending organism and manifestation of the signs and symptoms. In case of measles, the incubation period is roughly 10 days. If the measles virus enters in our body or enters into one's body, the person will not develop immediately signs and symptoms. That means the person, the rash will not appear or there will not be manifestation of the measles like running nose, redness of the eyes, fever. So, these manifestations will occur after few days. So, roughly incubation period is the entry of the organism and onset of the signs and symptoms. This duration varies from case to case. For chicken pox, roughly the incubation period is 14 days. For measles, it is 10 days. For diphtheria, it is food poisoning, roughly 1 to 2 days. For diarrhea, for 1 to 2 days. So, the incubation period varies from case to case. Clear? So, time is the incubation period or the total period starting from the onset of the disease till recovery or death or invalidity. Disease process starts from one point and ends either complete recovery or death or partial recovery, giving rise to some sequelae. Suppose a person suffered from meningitis, he recovered, but he is not fully able to work his activities. There is some motor dysfunction. So, it gives rise to some sequelae. So, disease process starts and after few days or after few months, either the person will recover completely or there will be some sequelae or there will be death of that person. So, this total process is the natural history of disease. What is natural history of disease? Natural history of disease means when a disease process evolves over time, starting from its pre-pathogenesis state to pathogenesis state without any interruption of the disease process. Clear? So, natural history of disease means it is the total period of the disease process starting from its pre-pathogenesis phase to pathogenesis phase till recovery or death or some chronic manifestation giving rise to some sequelae without giving any interruption by the physician. We can cut short the duration of illness by means of early diagnosis and treatment. So, the duration of illness will be shortened and person will be recovered fully. But if we do not give any intervention, we are not giving any type of intervention. So, if the body's immunity or the body's defense mechanism is sufficient enough to cope up the situation, the person will recover fully. Clear? Without any medication, the person may recover fully or person may succumb to death. His defense mechanism is not sufficient enough to cope up with the infecting agent and ultimately the person may die or person may recover partially and having some chronic disability. Clear? So, natural history of disease means we are not giving any type of intervention. So, it is the total disease process or the disease evolves over time starting from pre-pathogenesis phase till recovery or death or partial recovery with some sequelae without having any intervention. Clear? So, this triangle, that is agent, host and environment, is called epidemiological triad. Epidemiological triad. It is very important. Epidemiological triad. So, there is there is an equilibrium among these three. So, if the equilibrium is disturbed, it may be due to some natural disaster, or it may be some man-made disaster, or it may be some suitable environment for the multiplication of the offending organisms, then the equilibrium will be disturbed and the disease process will start. There are two stages. One is pre-pathogenesis phase. Pre-pathogenic phase usually starts in the environment and pathogenic states starts in the human body or within the host. Now, what is agent? Agent is a substance, it may be living or it may be non-living, or a force, it may be tangible or it may be intangible. Tangible means which is visible, intangible means which is not visible. So, agent is a substance living or non-living, or a force tangible or intangible, excessive presence or relative lack of which may initiate or perpetuate a disease process. So, agent is a substance living or non-living, or a force tangible or intangible, excessive present or relative lack of which may initiate or perpetuate a disease process. Now, let us discuss one by one. Agent, there are various types of agent. One is physical agent. Physical agent means, what is physical agent? Air, water, earth, these are all physical agent. Radiation, humidity, these are the physical agent. What is biological agent? Biological means all the living things, starting from bacteria, virus, protozoa, next is any type of allergens. Allergens, of course, it is non-living. So, any other animals. So, these are the biological agent. Next is chemical agent. Chemical agent, poisons, these are the biological agent. So, there are various types of agents. Another example of agent is vitamins, nutrients. If we take less amount of vitamin, like we are taking less amount of vitamin A or less amount of micronutrient, like less amount of iodine. So, if there is less intake or there is excessive intake, disease process will start. Or there may be some another agent, like if there is high blood urea, that agent will cause various diseases. So, these are the agent. Next, force. If there is heavy cyclonic storm, the person may sustain injury due to the external force, or if there is friction, mechanical force. You are working in such an environment, there is constant friction, and ultimately there will be many disease manifestation in the form of there is frictional state in the skin. So, these are the mechanical force. So, these are the various types of agents. Next is environment. Next is host. Host means usually we consider the human beings or the animals. So, among the host there are demographic characteristics. Particular group of people or particular group of community people suffer from a particular disease. You know that sickle cell anemia are more among the Africans. Sickle cell anemia are more among the Africans. Or the person who is having genetic defect, trisomy 21, due to the extra chromosome, or Turner due to the XO. So, if there is chromosomal defect, there will be disease manifestation. So, it is the biological characteristics of that individual, or it is the demographic characteristics. Demographic characteristic means age, sex composition, living conditions. So, these are the various factors among the host, or also the socio-economic condition. Socio-economic condition of the host. If the person is suffering from in such an environment, that means if the person lives in an overcrowded room, there is more chance of development of respiratory infection like influenza, tuberculosis, or measles or chickenpox. So, it is the host factors which are also responsible for the causation of the diseases. Next is environment. Environment means there are various types of environment. One is psychosocial environment. One is psychosocial environment. That means the environment where there are various stressful situations. Kharpur IT technician working in a so stressful situation that after few years, say after 10 years or 15 years, many of the IT graduates develop hypertension, diabetes because of the stressful situation. They work for 18 hours, 16 hours. They are not getting sufficient rest. So, this is the psychosocial environment, or the person who is living in such a situation where most of the peer groups are alcoholic, or most of the peer groups are smokers, and ultimately due to the peer pressure he is also consuming alcohol, or he is also starts taking various offending drugs. It may be Venezuela or it may be Choros, and ultimately there will be various forms of disease manifestation. So, it is the psychosocial environment. Culture. He is living in such a community where there are various cultures which are not helpful for healthy living. There are various cultures which hinders our good health. But also on the contrary, there are some important cultures or habits which are helpful for our good health, like regular taking exercises. About 25 years back, I went to Delhi for some training and I stayed there for 1 month, and I found that most of the people, they are doing exercises regularly in the morning hours. Not only the elderly persons, but also even their children, they are doing exercises, yogas, and these good culture is various, this good culture helps us our health. Nowadays in Calcutta, many people are adopting this type of exercises regularly. Good culture or the good habit, and there are some bad culture. So our motto will be to encourage adoption of healthy behavior or the good cultures, and we reject the bad culture. We know that cigarette smoking is injurious to health. In spite of that, many doctors are smoking cigarettes, and at the chamber he is advising, you are suffering from hypertension, you are suffering from diabetes, so no smoking, no drinking alcohol, etc., etc. But the person who is opposite to your table will follow your advice. In presence of him, you are smoking cigarettes and you are advising that no smoking, no drinking alcohol. So, knowing all the bad effects of smoking, many doctors are not quitting taking cigarettes or drinking alcohol. So, it is very difficult to change your lifestyle within few days or within few months or within few years. It is very difficult to behave modestly so as to live a healthy living. We know that cigarette smoking not only causes lung cancer, but also it may cause hypertension. It gives rise to more chance of myocardial infarction, more chance of cancer, more chance of bladder cancer. So, we have to adopt healthy lifestyle. So, it is the environment which indirectly helps us for good health if the environment is favorable. But if the environment is not favorable, if the environment is hostile, suppose many students are staying in the hostel and few students could not cope up with the stress and strain, particularly for the newcomers because of ragging. Although there are various laws, various rules and regulations regarding anti-ragging, but in spite of that, almost in all institutions, almost all students are facing some type of ragging. So, this environment is not suitable for that particular newcomers, and few newcomers may not cope up with that hostile environment, and ultimately he may commit suicide. So, this environment indirectly pushes that newcomers to commit suicide. So, that is why environment is also equally important for the causation of disease. So, you have understood what is agent, you have understood what do you mean by host. Host means who is the sufferers, human beings or the animals, and the environment. Environment means not only psychosocial environment, but also socio-economic condition. Socio-economic condition, the living conditions. Suppose a person is living in such a condition where there is more humidity or where there is more breeding places of mosquitoes. We know that mosquitoes are responsible for various vector-borne diseases. Vector-borne diseases means the diseases which are transmitted by the vectors. Agent is separate. Suppose in case of malaria, what is the agent? Protozoa, but the vector is the Anopheles mosquito. So, these mosquitoes or these vectors are helping transmission of the disease from one person to another. So, if the environment is suitable enough for the breeding of the mosquitoes, there will be chance of development of various vector-borne diseases like malaria, like filaria, like dengue, like chikungunya, like kalajar. So these are the important vector-borne diseases. So our target will be to reduce the breeding places of mosquito. It may be by clearing the stagnant water, filling the ditches, or spraying the herbicides, or the spraying the DDT, so that the breeding places will be destroyed or the vector population will be diminished to such a level that there will be a congenial atmosphere among these agent, host and environment. The agent will not take the upper hand so as to produce that disease among us. Clear? So this is the epidemiological triad, that is agent, host and environment. If the equilibrium is disturbed, the disease process will start. Clear? What is natural history of the disease? Natural history of the disease means when a disease evolves over time, starting from pre-pathogenesis phase till recovery or death or partial recovery with some sequelae, without any interruption. Clear? Now, we the doctors try to break any leg of this triangle. We will try to break this leg or this leg. How? By means of various intervention. One is primary prevention, another is early diagnosis and treatment, and third is rehabilitation. What is primary prevention? Primary prevention means by giving vaccination. We are administering vaccine to a healthy child who has come to you for vaccination. How does this vaccine protect the child? Suppose if you give the BCG vaccine, you will be able to prevent development of miliary tuberculosis or meningeal tuberculosis, which are very fatal for this child. Clear? If you administer DPT vaccine, it will prevent not only diphtheria but also whooping cough and also tetanus. So, by means of various vaccines, we can prevent the childhood diseases. So, it is the primary prevention. Another mode of primary prevention, by supplementing various nutrients. We give beta A oil so as to improve the vitamin A level, so as not to develop various clinical forms of vitamin A deficiency. What are the various forms of vitamin A deficiency? Conjunctival xerosis, bitter spot, keratomalacia, night blindness. So these are the various forms of vitamin A deficiency. That's why Government of India is giving prophylactically. Prophylactically means before the onset of any disease, if you administer any chemotherapy or any nutrients to that particular person, is called prophylaxis. So we administer beta A oil. First dose at 9 months, at 9 completed months, dose is 1 lakh. But subsequently, after 1 year, dose is 2 lakhs international unit. And how many doses? Total 9 doses till the age of 5 years. Up to 5 years, at an interval of 6 months, beta A oil is administered, so that the child will not suffer from vitamin A deficiency. Clear? So, by means of vaccination or by means of chemoprophylaxis, suppose a person came in India and he is the resident of say America. If you prescribe chloroquine tablets, 2 tablets every week for 4 weeks, the person will not suffer from malaria. The person will not suffer from malaria. Or if a mother suffering from pulmonary tuberculosis gave birth to a child, there is chance of developing tuberculosis to the newborn. So, if you give INH prophylaxis, then the child will not suffer from tuberculosis. So, by means of vaccination or by means of chemoprophylaxis, we can prevent development of the disease. So, it is the primary prevention. Or if you just give advice, regular physical exercise starting from the early childhood, if a person adopts this healthy lifestyle, there is minimal chance of development of hypertension or coronary heart disease. So, it is the primary prevention. Better to say it is the primordial prevention. That is, what is primordial prevention and what is primary prevention? Primordial prevention means adoption of healthy lifestyle before appearance of risk factor. Before appearance of risk factor. And what is primary prevention? Primary prevention, it can be done by giving vaccination or it can be done by giving chemoprophylaxis. So, after appearance of risk factor, if you adopt healthy lifestyle, that is primary prevention. Suppose your cholesterol level is high, above the normal, and at that point you advised him to take healthy diet, to do regular exercise, that is primary prevention, that is not primordial prevention. There is no clear cut demarcation between primordial prevention and primary prevention. As a whole, these are all primary prevention, but primordial prevention means adoption of healthy lifestyle before appearance of risk factor. If you advise a young child, say 5 years, that from this day onwards you will do regular exercise, so that there will be less or minimal chance of development of hypertension or development of diabetes, etc. Clear? So, it is the primordial prevention, that means before appearance of risk factor. Clear? What is secondary prevention? Secondary prevention means disease process has already started and you have advised some important tests so as to stamp the person, yes, that you are suffering from diabetes, you are suffering from hypertension. So, secondary prevention means early diagnosis and treatment. As early as you will diagnose, you will give treatment accordingly and patient will be recovered fully. Suppose a person is suffering from tuberculosis, suffering from fever for last 1 month, cough, night sweat, loss of weight, etc., etc. And the person came to you and you failed to diagnose that this person is suffering from tuberculosis. You advised ordinary antibiotic for 7 days and after 7 days the person came to you, again you change the antibiotic, you continue this antibiotic. In this way the diagnosis was delayed. It may be due to some extent your failure to diagnose at an early stage, or it may be due to delayed reporting to you. Patient came to you after 3 months when he is not able to move about, his relatives brought him to you, this person is not able to walk, there is some respiratory distress and cough and also irregular fever, and you diagnose that this person is suffering from tuberculosis, there is cavitation, on the both sides of the lungs and there is respiratory distress. So, diagnosis was delayed. So, diagnosis may be delayed due to the fault on the part of the patient or the patient party, or it may be fault on the part of the physicians. We may not diagnose at an early stage. It may be our fault. So, our motto will be to diagnose the case as early as possible, so as to not only prevent death or chronicity with some sequelae, but also to prevent transmission of the disease from one person to another. Because if a person suffers from TB and if he is not taking any antituberculosis drug, he is infective to others. He will transmit the disease to his close relatives, to his roommates. That's why we will try always to diagnose the case as early as possible, and we will prescribe the medicines accordingly, so that the person will not only be non-infectious, but also he will recover fully. There is chance of complete recovery is more and more when the disease is diagnosed at a very early stage. If we take the example of diabetes, in case of diabetes, apparently there is no signs and symptoms. Patient is moving around, no problem. After say 4 or 5 years, patient complained of some weakness, loss of energy. ডাক্তার আমি আগের মতো কাজ করতে পারছি না, একটু দুর্বল ফিল করছি। And if you do the blood test, you found that blood sugar level is 500 milligram per cent. Normally it should be less than 140 or less than 126, but it is 500. Apparently there is no disease manifestation. But if we do various tests like retinoscopy, there may be some changes in the retina. If we do the urea creatinine, so there may be high urea or creatinine. So the various organs are gradually being affected. So our aim will be to diagnose the case as early as possible, so as to prevent any death or any sequelae, and patient will be able to recover fully. If we give particular medicine or the particular drugs, patient will recover fully. Suppose a patient is suffering from prostatic cancer. There is no signs and symptoms. Only patient may have some swelling of the legs. And if you advise, particularly for elderly person above 60 years, every male person should undergo PSA test, prostate specific antigen. And if the prostate specific antigen is high, then you keep in mind that the person may suffer from prostate cancer. Clear? And for that he will advise various investigations to clinch the diagnosis. But if the person comes late to you, he may have some metastasis. Metastasis may be in the vertebral column, or maybe in the ribs, or maybe in the skull bone. So it is too late. So if you diagnose in the late hours, then chance of prognosis is poor. Patient will survive hardly 1 year or 2 years or 3 years. But if you are able to diagnose at an early stage, that means before metastasis, and if you give some important drugs for that patient, patient will live a long life. He may live for 10 years, 15 years, 20 years. So that's why it is important to diagnose as early as possible and to give full complete treatment. Full complete treatment. A TB patient needs treatment at least for 9 months. But after 2 months, patient is not taking medicine because he is feeling well and there is no fever, no cough, no problem. But it is your duty to make him understand that you are suffering from a notorious disease which is tuberculosis, and this disease will be cured if you take medicine at least for 9 months or till your physician stops you to take the drugs. It is not like influenza. After 5 or 6 or 7 days, patient will recover completely. So, it is your duty to motivate your patient that you must take these drugs till full recovery or till doctors stops you to take these drugs. There are some diseases which needs lifelong treatment. What type of disease? Diabetes, hypertension. If a person is diagnosed suffering from type 2 diabetes, then not only lifestyle modification, that means avoiding excessive food, particularly the sugar containing foods, but also at the same time he has to take oral hypoglycemic drugs. If the oral hypoglycemic drugs fails to control the blood sugar level, then he is advised to take insulin injection, and this type of patient needs regular follow-up and medicine or insulin will be continued till death. Like hypertension, person is suffering from high blood sugar, high blood pressure, 220 by 110. So this person needs regular follow-up and regular medication. Not that after 2 months blood pressure was controlled and patient will stop taking medicine. So there are some diseases where patient needs lifelong treatment, or there are some diseases where patient needs treatment for several months or several years, or there are some diseases where patient needs treatment for 2 weeks or 3 weeks. In case of typhoid, patient needs treatment for 2 to 3 weeks, not 5 days or 7 days. But in case of diarrhea, in case of influenza, patient needs treatment hardly 5 to 7 days. So, depending on the type of the disease, patient may have to take treatment for lying long, or patient may have to take treatment for few months or few years, or may have to take medicine for few days. Clear? So, let us recapitulate. What is epidemiological triad? It is the interaction of agent, host and environment, and if these 3 factors, that is agent, host and environment, usually there is an equilibrium among these 3. If the equilibrium is disturbed, somehow the disease process will initiate. And what is these 3 are called the epidemiological triad. So our motto will be to break any of the legs so as to prevent the disease process in the community or within the human host. Clear? Now, what is the natural history of the disease? Natural history of the disease means when a disease evolves over time, starting from the pre-pathogenesis state up to full recovery or death or partial recovery with some disability. Clear? Without any intervention. That is natural history of the disease. And how we know the natural history of the disease? We do cohort study. There are various types of study. One is cohort study, another is case control study. So, by means of cohort study, we can establish the natural history of the disease. By means of framing a heart study, it was a long study for 10 years, 20 years study, and the epidemiologist found out that there are various manifestations of a disease. If we do not intervene, the disease will evolve in various ways. It may be full recovery or partial recovery or death. So, natural history of the disease means without any intervention how the disease evolves over time. So, one is natural history of the disease, another is epidemiological triad, and lastly what is agent, what is host and what is environment. Clear? গিয়ে একটু বইগুলো পড়তে হবে, না পড়লে হবে না। টেক্সট বই কার কার কেনা হয়েছে? Have any of you purchased Park textbook of medicine? No one? PDF আছে তো? History of medicine. It is interesting to know the history of disease, but for undergraduate level usually there is no question from history of medicine, but for postgraduate student history of medicine is important. But if you read the history of medicine, it will be very much easier to understand. Before the germ theory, there was superstition. People believe that disease is due to some superstition. A leprosy patient was thrown outside of community because people thought that this leprosy is due to some sin he committed before, that's why he is suffering from leprosy. But nowadays we know that leprosy is caused by Mycobacterium leprae. This is a bacteria and there is drug, and if the patient takes the anti-leprosy drugs, dapsone, clofazimine and ethambutol, dapsone, clofazimine and another is at this moment I cannot remember. So, if the patient takes anti-leprosy drug, he will recover fully after 1 year or after 1.5 years. But still today, many community people think that leprosy is due to some sin he committed previously. So, before the bacteria, protozoa, these causative agents were discovered, people thought that it is due to the supernatural theory, due to the superstition. After that, in the late 19 or early 20, various bacteria were discovered. Vibrio cholerae were discovered, microbial diphtheria, typhus bacilli was discovered, gonorrhea organism was discovered. So, various organisms were discovered and people thought that this is due to one-to-one relation. But after say 50 or 100 years later, it was found that not only the virus, bacteria or protozoa are responsible for causation of disease, but other multiple factors, particularly for non-communicable diseases, are responsible for the diseases. Various social factors are responsible for the causation of the disease. So, in this way, over the years, research is going on and on. So, now we say that disease is not only due to a particular agent, but also for some important factors which have some bearing on the health of an individual. That's why the definition of health includes complete physical, mental and social. These three elements are there. Social element, emotional, psychosocial element. So these are the important factors which are responsible for the question of the disease.